As people get older, their body structure change and their physiological balance. There's a decreased speed and power of skeletal muscle contraction. It is due to decrease in muscle fiber. There's a joint stiffness which is caused by drying and loss of elasticity in joint cartilage. And an impaired balance happens due to decreased muscle strength, reaction time, and coordination and change in center of gravity. The reaction time is slowed because there is a diminished conduction speed of nerve fibers and decreased muscle tone. Also, there is a loss of height due to atrophy of intervertebral disc, increased flexion at hips and knees. That's why older person is prone or at risk to fall. Not only that, the neuromusculoskeletal changes, but also the sensory perceptual like loss of visual acuity due to degeneration leading to lens opacity. Though there are others that can cause changes to older person that might put them at risk to other sort of problem. Grandma, 70 years old, lives in her house with her maid. She doesn't have any relatives. Recently, she's been feeling some pain in her back, dyspnea, and slow body movement. The same goes with her reaction time. Also, she feels dizzy sometimes. She also experiences difficulty in grasping and reaching things. Then one day, she fell from her bed. Luckily, she was found immediately by her maid. After several weeks of confinement in the hospital, she was discharged without any surgery done.
Perform ROM exercise to joints unless contraindicated at least once every visit. This prevents joint contractures and muscle atrophy.
Ride assisted device like cane and walker. The use of assistive devices helps the patient walk with great balance and supports and relieves the pressure on the weight-bearing joints by redistributing weight. Turn and reposition patient every 2 hours. Establish a turning schedule and pose at bedside. This is to prevent skin breakdown by relieving pressure. Place items within reach of the unaffected arm. This improves patient's independence. 1. Prevent fall-related injuries and death by adapting the environment as much as possible to reduce the risk for fall-related injuries. Heavy furniture that is in a pathway where a fall is likely to occur can be made out of the way or placed with items that will move easily if the person falls into them. Also, hard edges of furniture and built-in cabinets can be padded. Soft mats can be placed near beds and in other locations where people are likely to fall, but caution must be used so that these pads do not become fall risk. Assess musculoskeletal performance. This is to provide tolerable nursing interventions.
How are you today, ma'am? Is there something bothering you? Don't be afraid to share or express your fears.
Encourage patient to address fear of falling. Any interventions that reduce the risk of falls are also likely to reduce a person's fear of falling, but some people may need additional interventions to address this problem. Nurses can address fear of falling in the same way they address other fears. Encourage the expression of feeling and provide education and reassurance about interventions that are being implemented as part of an individualized fall prevention care plan. Refer patient to a physical therapist for development of mobility regimen.
Good afternoon, sir. I'm Mel.A, Grandma's private nurse.
Good afternoon, Nurse Acosta.
Please come in. Grandma, this is the physical therapist I told you about.
Good afternoon, Grandma.
Referring the patient to a physical therapist helps rehabilitate musculoskeletal deficit.
Include occupational therapist and rehabilitation provider in creating movement program and identifying assistive devices.
Cut.
This program is done to promote mobility and enhance environmental safety. Assess and encourage the need for patient to use eyeglasses, hearing aid, or other adaptive devices. This is done to help reduce sensory deprivation. Facilitate use of hearing aids if needed. Hearing can be enhanced if the volume is appropriate and the hearing aid is consistently used. Good afternoon, Grandma. Have you eaten your lunch?
Can you repeat what you said?
Said Grandma, have you eaten your lunch?
Provide health promotion teaching by suggesting that the elder be referred for hearing screening. To help avoid increased hearing loss.
They involve safety ways and subsequent interventions, such as setting the temperature of the water heater to 110 degrees Fahrenheit. This places the older adult to prevent higher risk for burns and other injuries.
Good morning, Grandma. I am your nurse for today. I am calling you, Grandma. How are you today? I am having difficulty with speak. Some sensitivity.
Assess and encourage the patient for the use of eyeglasses. This is done to help reduce visual deprivation.
Why? What's the problem? I can't smell the food. It seems like there's no taste.
Educate patient about feeding and other requirements. Leaving the facility or healthcare environment helps reduce patient sensory deprivation and promote mental acuity. Help older adult in maintaining the quality of life by using reading glasses and good environmental lighting. Lighting may enable the older adult to read books, newspapers, magazine, etc. The older adult's quality of life may improve because they experience satisfying social interactions and increased intellectual stimulation.
Schedule routine eye examination to maintain and protect the vision.
Hello, this is Dr. Acosta from Audiology Department. How may I help you?
Hello, this is Miss Shans. I'm here to refer about my patient, Grandma.
Yes? What is it?
Referral for audiology survey to evaluate and more thoroughly determine the best approach for facilitating the best outcome.
involve the dietitian in providing a rehabilitative therapy regarding sense of smell and taste.
Hi, I'm Joanne and I am the dietitian.
This is done to assist in managing possible complication of gustatory impairment and to achieve maximal gains in functions of well-being.